Okay, all set.
Yeah. Okay, we're ready to go.
Can you guys see me now?
You were there for a moment and then you disappeared again.
Okay, we're streaming now, just so you know.
It is the weirdest thing.
You were there. I saw you very clearly, and then it went black.
Yeah, I
There you
still
are.
see her though.
I see again. Well, actually,
Okay.
there's two of them.
Yes, there are two.
Oh, great.
So it sounds like we're having just a moment of technical difficulty.
But I'm sorry if you're seeing me twice. Glad you can see me at all. But I think we'll get started. And I have my phone on for you so you can see my face, but my computer on. I don't know what's happening. And I had a call this morning and it was fine. So, okay, so we have some follow-up from our December 3rd meeting. So I have the minutes for approval. Can I have a motion?
So moved.
May I have a second?
Second, second.
Any discussion or edits? All in favor?
Aye.
Aye.
Aye. All right, very good. So we do have some follow-up for the December 3rd meeting. The timeline for the opening for the EDHC, and also a status of the CHIP process and participation. And I'm going to guess that Christina, you're going to follow up on that for us.
Yes, I will. So in our last meeting, Pam Howard, the administrator for the Office of Mental Health, joined us to provide an overview of mental health and mental health services and work in Montgomery County. She provided an update on the development of an emergency behavioral health center that will be located in King of Prussia. I believe there was a question about the timeline for opening the EBHC as a request for follow-up. I did not hear back just yet from Pam Howard about that, but I believe, Dr. McKernan, that it's this calendar year, or is it in the summer of 2027?
The goal is by the end of this calendar year.
Thank you.
So we're hoping, I think in my head, we are looking at a November start, but that could be, it's subject to change. They are currently under construction.
Thank you. And with regard to the status of the CHIP process and participation, there were some suggestions and recommendations to engage health systems sooner rather than later in the community health improvement planning process. Some of you have probably noticed that we've done some additional outreach to our health systems. We've heard back from some of them, not all. We're continuing to work to engage our health systems in the planning process, the community health improvement planning process, because most of our health systems themselves have community health improvement plans. So to the extent that we can coordinate with them, there's a benefit for all of our residents. So we have engaged some in work groups to help us define, we're calling them think tanks, define the goals for our community health improvement plan. The next step in the process, which I anticipate will begin this fall, will be action groups, and we'll continue to do outreach to engage particularly the community health programs and the population health programs in those processes as we clarify what our goals will be for the community health improvement plan. Are there any questions about either of those?
Just one question regarding the Behavioral Health Center, which is fantastic, obviously. Is there a connection or an integration with what I've learned are now the transitions programs, which basically keep people for, I guess, 2 days, 2 nights to maybe 10 to 12 nights, short term, while they're waiting for placement?
Would you like? I could answer. So thank you. The intent, sort of, I think that if I'm clear, the transition centers, I'm not sure, are you talking about the shelter programs that we're opening that have been?
No, I just was learning from other counties in the state that they have these transition programs where people can go, and maybe they are smaller residential programs, but they can, in a sense, be inpatient before they get placed inpatient. Because this behavioral health center, as I understand it, is much more, there's plenty of need, much more outpatient, correct?
Correct. Right. So the majority of this is, it's, as it says, it's an emergency behavioral health walk-in center. So the intention is to stabilize people and connect them with the next level of care. So some of that could look like residential services. It could look like outpatient. It could look, it depends on the need and presenting issue. So it is not necessarily the same. I know that other counties have stood up other diversionary programs in Bucks County specifically last week. But it is intended to connect people to services to reduce their likelihood of ending up in the emergency room or worse. So it is intended to connect to all systems depending on the presenting need.
Okay, thank you.
Yep.
Any other questions out there? Okay. This is the section of the agenda. If it's okay, I can move on to the health administrator report. So during the administrator report section of the meeting, I typically share updates on key personnel changes, particularly those that affect our operations, and significant new or renewed contracts, and updates on public health funding. So that's what we'll cover this morning. In terms of key personnel, the last time we got together, I believe I reported that we had a vacancy in our Director for Health Equity and Epidemiology role. That position was vacated in October of 2025. We're very excited to share that we have extended an offer to a candidate, and the approval for that candidate is pending salary board approval tomorrow morning. So we expect that by the next Board of Health meeting, we'll be able to introduce you to our new Director for Health Equity and Epidemiology, and that will be starting by the end of this month. Next, our Quality Manager. This role was added to our staffing complement through the Public Health Infrastructure Grant, and it was filled in 2025. This position, however, was vacated in January, and we posted the position and expect to fill it by the end of April. The position is primarily responsible for shepherding our accreditation process. So the person that held this role made tremendous progress in creating the structure and assessing gaps, but the work is paused until the position is filled. We anticipate a bit of a delay in assembling and submitting our application for accreditation this year, but we nevertheless expect to submit the application this calendar year. In terms of contracts, OPH, the Office of Public Health, has extended its contract with Summit Exercises and Training to support emergency preparedness and planning. In particular, we are working to solidify roles of Health and Human Services team in an emergency response and the recovery from an emergency. In addition, and you'll hear a little bit more about this later, our environmental health and water quality management teams have been working towards development of a new data platform or procurement of a new data platform to house information about things like inspections and the work that those teams do. We're expecting approval of that platform provider supporting those two divisions at our commissioners meeting tomorrow morning, with implementation of that new platform occurring over the coming year and hopefully completed by this fall. In terms of funding, I want to share a little bit about what we have, what we anticipate as level of funding for multiple program areas. Over the past year, we've been particularly concerned about public health funding and declines or decreases in public health funding. We've already heard from some of our points of contact at state and federal levels that anticipated funding levels for the coming year will be level. However, we have experienced a reduction already in funding for immunizations. Areas that we anticipate will remain level in terms of funding include things like emergency preparedness, healthcare-associated infection, disease surveillance, and overdose prevention. So it's a little bit of a mixed picture right now. Decreased funding for immunizations already communicated. Meanwhile, we're anticipating level funding for some of our other program areas.
Christina, what does that actually mean? Like, I get it's a decrease in funding. So how does that impact the operations and our ability to administer vaccines?
Absolutely. That's an excellent question. Since the beginning of 2025, we've been taking a very close look at our fiscal picture and our finances for public health funding. We are very fortunate to have what we call public health infrastructure funding available to us. It's called the Public Health Infrastructure Grant, and that is specifically geared towards the recruitment, retention, and professional growth and advancement of public health workforce. So we've been doing quite a bit of planning around ensuring that we can effectively retain our staff through other funding streams, that being one of them. So right now, we aren't feeling a staffing impact, but we are, because we have been doing this planning on the back end to ensure that we can maintain our services and maintain our staffing levels.
Great, that's very good to hear. Thank you.
A point that is consistently front of mind for us, though, is what happens at the end of that public health infrastructure grant in November of 2027. So this, like I said, this grant was awarded to support recruitment, retention, and professional advancement of the public health workforce. It has enabled us locally to add positions in our communicable disease and environmental health teams that were really experiencing a heavy burden, a growing burden of daily activities and operations without ability to expand the workforce. So that enabled us to expand the workforce there, create new roles like a data manager position that you'll hear a little bit about later, a quality manager. This is really enabling us also to invest in community health worker programs that provide health education and connection to healthcare in the communities that we serve. So this has been a really important grant and funding source for us. And what you'll hear about also as we talk a little bit about the priorities for the year ahead is continuing to diversify the funding that supports public health work going forward into the coming year.
That's great.
Any other questions?
Okay, does that conclude your report, Christina?
It does.
Okay, all right, so we'll turn it over to Dr. Patricia McKernan.
Good morning. I apologize. I was just here to say hello and welcome. I am newly on the job here. I started as the director for Health and Human Services in December. I'm very excited to work along with Christina and her staff in the public health space. My background, last 30 years have been working with nonprofits, specifically assisting people coming home from prison, running shelters, senior housing, and most recently spending the last 6 years working with substance use disorder treatment, all providers being multi-state. So this has been an exciting opportunity here in Montgomery County to see all of those places, all of that work experience intersect just like Health and Human Services does. So very excited to be here. Thank you for inviting me to the meeting this morning. Christina and I have, just as an aside, we are taking a look at all things under HHS, specifically as it relates to public health. Christina and I have been looking at utilization data. Certainly, I don't know, Christina, if you've already communicated some of the changes related to space and where we're going to be allocated. If Willow Grove is under construction, I'm sure you've already, or is about to be under construction, you may have already discussed that. Health and Human Services has multiple locations. Norristown, we have Pottstown, Lansdale, and Willow Grove. Willow Grove was a location where public health had a significant footprint, and that space is being renovated. So we have some transitional plans that we need to work out, and not only for public health, but and with that, looking at the utilization in all sites for both for public health and the other offices that are represented there. Christine and I got a chance to talk more in depth about the community health assessment. Very excited to lean into the work that's been done so far. I will own that I love disruptive questions. So I am going to be asking some of those of all of you in public health related to that as we, co-create the community health improvement plan. We will be spending a fair amount of time on that with our next cabinet meeting within Health and Human Services in March. I'm just here to say thank you for your service on the Board of Health, and for all of the staff that are here also on the call. Thank you for all that you do. But yeah, thank you, Christina, for the space to just say good morning.
Welcome. We're very excited to have you here.
Yes, welcome. Very nice to meet you. Thank you.
Thank you.
Okay, so I'm going to move on to the 2025 review and accomplishments. We're actually going to ask you to look at the program summary and the key open activities. So we're not going to cover that as part of the agenda. And so we'll move into the Office of Public Health Priorities for 2026.
Thank you. So our first meeting of the year provides an opportunity for us to communicate the status of the overarching and team-specific priorities from the previous year, and also to talk a little bit about the specific priorities for Office of Public Health and for each of the teams for the coming year. As Barbara mentioned, you'll see a summary of key points about our work over the past year in the board summary, the program summary. This is where we provide quarterly updates about day-to-day operations. This quarter's report covers the full year of 2025 compared with the same operations data for 2024. So here you'll see, for example, numbers of inspections, response to disease reports, community education. I really encourage you to read through this. It captures a lot of that day-to-day work that this team does. For example, our team conducted more than 7,500 inspections of food service facilities, pools, schools, and campgrounds, initiated more than 12,000 investigations resulting from reports of communicable disease, trained more than 500 people to conduct CPR, AED, and administer naloxone, life-saving skills. Engaged more than 1,700 people and 300 dogs in the 10th annual Montgomery County Trail Challenge. We administered more than 5,000 vaccinations, conducted 600 on-lot sewage inspections. This team does a lot in a year. And I have just, as a point of recognition, as both a colleague and a resident of this county, I'm grateful and I'm proud every single day that I have the honor to work alongside this team. They are incredibly skilled, compassionate, and endlessly dedicated to public health. And so, please take a look through that report. It does capture a lot of what this team does on a day-to-day basis. And we'll use our time instead today to talk about some of the key priorities that you won't necessarily see covered in that summary of operations. These are the priorities focused on growing and strengthening our work and our infrastructure, our staff and our systems development, connection with communities, and what we are, some of the work that we're doing looking forward.
Christina and Barbara, I just have one question or comment. I agree. It's amazing how much was done by you, the team, and others. I did, and I saw something I don't think I've seen before, and I have other questions, but I will not do it now. The whole wellness initiative with employees, I don't recall that. Is that a new exercise this year?
When you say the wellness initiative,
it says there's a staff there was a staff wellness survey completed, 550 staff members, 349 participated. I agree the engagement rate, which is key on that. I guess where I was going, because I'm involved in something in the same space, I think this is a phenomenal, great initiative for the employees, and it sort of inspires them, in all the work that they're doing. I'm just curious as to, are we engaging, say, our health insurance provider, because I think there's opportunities to basically think down the line about restructuring even the plan. Just something to think about for the future.
Yeah,
because
absolutely.
I didn't see this one. We haven't done this before, have we?
So this is actually work that's being done with Pottstown School District.
Oh, I thought this was. It implied it was the county employees too. No, so it's not. Okay.
Yep. So this falls under our school health and wellness.
Fair enough. This is only Pottstown School. Okay, got it.
Yep, you got it.
Thank you for that clarification. I thought it was our employees, which I thought would be a great idea too.
Absolutely. And you may recall, so in 2024, I had to take a moment to think back with what year it was, but in 2024, we did do a staff, it was a workforce development survey, and it covered a variety of topics ranging from public health competencies to wellness, and it was really designed to help us design and develop a staff engagement, staff professional growth and development plan to really help us set out priorities for building our human infrastructure. So it might be worthwhile for us to come back to that at some point. We're going to talk a little bit about some of the priorities that we've covered
I'm good.
the past year.
I didn't realize it was Pottstown, but that's a fantastic initiative with Pottstown as well. So to me, broadcasting that to other school districts would be a plus as well.
Like
and maybe that's
Great.
part of the plan. Sorry. Okay,
Yeah.
I'll stop and listen.
I appreciate that. Thank you. I'm just making a quick note. All right, so let's see. I want to talk a little bit about 2025 priorities. Excuse me for just one second. I need to come back to actually the webinar here. Great. So over the for the Office of Public Health, broadly speaking, and the way that we'll talk through this section of the meeting, we'll talk through OPH-wide priorities for the previous year, and then how those connect to our priorities for the coming year. And then each of our teams will do the same. So we'll start with OPH broadly. Three of our overarching priorities were around community engagement, staff development, and public health resources. So, in 2025, in that community engagement, under that community engagement priority, was really launching that community health improvement planning process and launching a campaign around public health at work in our community. What public health does in our community. This is really about helping to illuminate how public health shows up every day. Public health is often in the background. We often don't see or really notice the work of public health until we have an emergency of some kind, or we have to really come face to face with public health workers. So we really wanted to be able to illuminate a little bit more clearly what public health does. So in 2025, we did initiate that planning process. We created a structure, a process, and a plan. To date, we've actually engaged more than 30 organizations to participate in those think tank groups that I mentioned. Those think tank groups are helping us to define goals within the top 3 priorities that our residents identified through that community health survey. Those were mental health and wellness, chronic disease prevention and management, and healthy and safe environments. So we have community-based organizations, partner organizations, and this is where some of our health systems come into play, helping us to really define what our goals should look like, what the specific areas of focus can be within each of those 3 broad priorities. In addition, we started to revise and update our health alert and health advisory framework. So this is our response communication framework. When there's an emergency of some kind, this is the structure by which we notify health systems of a public health emergency in particular. We also conducted 7 community conversations, and as I mentioned, launched that public health at work in our community campaign, primarily via social media. Next slide, please. In terms of staff development, we had 3 primary priorities, or 3 main priorities. 1, expanding our staff capacity, developing and implementing a training plan, and developing an internship program. We really focused on that staff capacity priority in 2025. We were approved to add 8 new positions to the Office of Public Health. This has been a truly remarkable investment in our staff. We were able to add 2 positions to our communicable disease team. As I mentioned, these are folks that are responding to more than 12,000 reports of communicable disease in a year. It's a relatively small team, so adding capacity there is really will make a difference in terms of capacity and reducing the overwhelm and the burden on that team. Similarly, our environmental health team, these are inspectors that are out in the community every single day, ensuring that food and beverage facilities are adhering to FDA guidelines for safe food. We expanded staff capacity there. That also enabled us to move from 3 teams covering 3 regions of the county to 4 teams, and breaking up the county into 4 regions instead of 3. This really shortens commute times, travel times, and really helps to focus folks in a particular region of the county. So we are, for the first time, in 2025 was the first time we were actually at full capacity with that environmental health team. It was truly a change, and we're very excited about the changes that we're seeing going forward. We also added a data manager, and we established capacity, established new positions in quality and workforce development. As I mentioned, this quality manager is the person who's shepherding that accreditation process, and will really be working with all of our teams to strengthen the quality improvement and quality assurance processes across Office of Public Health. Our workforce development coordinator has been integral in helping us to develop and soon launch a new onboarding program for Office of Public Health staff, develop training plans, and also begin the development of that internship program. Next slide. Last is resource development, and I alluded to this a little bit during the health administrator report. It is critical for us to really look at how we can expand public health financial support. For us, this really means, in all likelihood, insurance billing. And I know, this group here, the Board of Health, has really encouraged us to pursue this for quite some time. What we're looking at this point is, how our EMR supports and enables us to conduct billing, what capacity we either need to have on staff or contract with to conduct that billing, and really do that assessment of the work that we are doing, what is billable, and what processes and protocols do we need to put into place in order to achieve that. So we have initiated the groundwork for insurance billing. We've also started to engage some of our peers across the Commonwealth to understand their policies, their protocols, and started to form a work group so that we can grow and learn together. Are there any questions about some of the work that we've been doing for the past year on these priorities? Okay. So looking ahead, you'll see our priorities for the coming year organized a little bit differently, and that's because HHS, the Department of Health and Human Services here in Montgomery County, launched its strategic plan and strategic priorities just last year. And so we've reorganized our priorities to align with the three primary pillars for the HHS strategic plan. So you'll see here those three pillars are centralized information, public relations and community engagement, and systems transformation. And what you'll see here largely is something of a continuation, right? We haven't fully accomplished all of the things that we had set out to do last year. These continue to be priorities for us. So you'll see here in terms of centralized information, dashboard development that will help to guide our operations and our decision-making. So dashboards that will capture some of our key performance metrics. And also, that third point there, dashboards that can be public-facing to increase access to public health information for our communities who are also doing public health work, who are also doing health and human services work, so that this can be a resource to them. We really started this with the launch of our community health assessment last year, which makes a lot of public health information available about Montgomery County in one consolidated place. And we're really hoping to use that as a launch pad for more work that we can do to share information about health and wellness in Montgomery County. In addition, we've developed some internal work around facilitating secure information sharing across HHS and with partner organizations. So our solicitor's office, for example, has increased capacity. Thanks, Ben Field is here as well as Christina Tarabello if they want to say anything more about this. But we've really been able to work more closely with our solicitor's office so that when we do have data sharing agreements or work that we're doing in partnership with health systems, academic partners, or other community-based organizations, that we are able to draw upon our solicitor's office to create those agreements and arrangements around secure and safe data sharing. I'll pause for a second in case Ben wants to say anything more about that.
Yeah, hi, it's Ben Field, and I'm here with Pat. Apologies for not being on camera. But I just wanted to say thank you for the shout out. And in this environment, data sharing becomes increasingly fraught. And so we've expanded our resources and appreciate the way you're working with largely Tyler Kate Dudley on my team, who's becoming a real subject matter expert in this area, and look forward to continue working with you on it.
Likewise. Thank you. Under that public health, public relations and community engagement pillar, you'll see here that we are moving towards operationalizing that health alert, health advisory system. So that's a responsive public health communications framework. What happens when there's an emergency? How are we getting information out to health systems, out to community partners? We've really started to build out that framework. Teresa Harris, who is our public health communications manager, has really been taking the lead in this work. And we are thrilled at the progress that has been made and where we are going for the coming year. We've engaged a partner organization to provide some training to our team and to do some work with us to really test protocols for communication during an emergency. So this is where we're really looking to turn from framework into implementation and operationalizing what we've begun to establish. The other large priority for us is really increasing our physical presence and connection in the communities that we're serving. And, Pat alluded to this earlier when she mentioned, really taking a look at our utilization, really meeting our communities where they are and where they need us to be. And you'll hear a little bit more about that also from Dave Genova later in this conversation. In terms of system transformation, this is where I'm thinking about our internal infrastructure, in particular, continuing to build the foundation for billing. Again, looking at, of the work that we're doing, what is billable, what systems need to be and protocols need to be put into place in order for us to achieve that billing, and specifically, what EMR or other data platforms do we need to have in order to successfully, and relationships do we need to have in order to begin to build that. This is going to continue to be a year of building, and I would anticipate that by 2027, we should be moving into that readiness to begin billing. Last, again, strengthening systems for staff growth and retention. We are very fortunate to have Emily Kramer on board. She is our workforce development coordinator. She has been absolutely phenomenal, really helping us to understand where our strengths and our gaps are in terms of retention, where we can grow and learn, and opportunities for us to strengthen even our job descriptions, strengthen opportunities for staff to grow within their field. So this will continue to be a year for strengthening those systems for retention and growth. Are there any questions? I expect that I or one of my colleagues will be reaching out to perhaps some of you just to get some insight, some experiences that you've had in your respective spaces, what's worked well for you, what lessons learned from all of you, and the work that you've done that can help to inform some of the work that we're doing here. I'm going to take this moment to pause and turn it over to my colleagues to talk through some of the very specific priorities for each of our divisions.
Thank you, Christina.
Good morning. Each year, so along with the day-to-day operations, divisions identify priorities to address, and of course, to work towards accomplishing them. So now each division directors will first report out their 2025 priority accomplishments, and then present their priorities for 2026. So with that, I'm going to ask Ruth Cole from Clinical Services to start.
Okay, so good morning, everybody. Thank you, Jay. So Clinical Services, we really are echoing some of what Christina just reviewed in terms of our department or office priorities. One of them being our assessing our technology, specifically our EMR options. We've been working on that this past year, and we will continue to be working on that, as she mentioned, into 2026, looking for enhancements, improvements on that realm, which is so key to clinical operations. So that has been something, like I said, we've been working on this past year and will continue to work next year. Another thing is, we're trying to always collaborate within our divisions. Something we wanted to enhance, which we've been doing in 2025 with our communicable disease division, is to focus on pregnant women with syphilis. And so we have been able to, implement protocols that have helped us be able to provide antibiotics to offices, OB/GYN offices that are treating women with syphilis. Believe it or not, it's often difficult to come by those antibiotics. So we have been able to be of assistance with that, providing those offices with those resources also, and guidance. Often, syphilis is kind of tricky. And so often we have OB/GYN offices that look to us for assistance. Dr. Lorraine isn't here today, but he's also been in the mix of helping to guide practitioners in the county as they've needed assistance. The other priority for 2025 is increasing our staffing level, which I feel that we've been successful. Right now we're at 83%. We hired one full-time public health nurse as well as 2 pool nurses. So I feel very satisfied that we are, at a good staffing level. Although turning to 2026, we can go to that next slide. Okay, again, we are focusing on enhancing our EMR functionality. So that is a long-term project. So we're excited about that. But also a challenge will be assessing billing services. It's very complicated. I'm sure everybody's aware if you've ever credentialed or contracted. So, wading into that space is tricky, but we are working on solutions and resources to be able to do that, to recover any kind of revenue that we can. And last but not least, as Pat actually mentioned too, Willow Grove, we want to be looking for a presence in Willow Grove when we start our renovation there. And so we have some prospects in mind of where we can relocate during the construction. Along with that, we will need to further enhance our staffing levels so that when we expand our services there. But that is what we're looking to accomplish in 2026.
Right. Thank you, Ruth. Next, Michelle Masters from Communicable Disease Control.
Hi, everyone. Happy Wednesday. Nice to see you today. It's good that I'm going right after clinical services and Ruth, because a lot of the goals for last year and priors for last year piggyback on Ruth's and the things that she relayed. So one of the things that we are hoping to accomplish is having a healthcare associated infection webinar. This is required under our PADOH SHARP grant. So in 2025, we were able to identify that we're going to be working with our long-term care and acute care facilities to really advocate and notify them of what our HAI program is, or healthcare associated program is, and how we support with multi-drug resistant responses. We are working with PADOH to get up this webinar scheduled for May of this year, as well as being able to offer continuing education credits with our facilities. So we're very excited to have that come in the next Q2 of this year. Like I said, piggybacking with Ruth, syphilis is very important, and our babies, we want to try to prevent congenital syphilis. So along with making sure that our pregnant women are treated and using medication through our clinical services, we've identified a target population that seems to be some gaps in services, and that's specifically working with pregnant women who are incarcerated at our correctional facility in the county, and making sure that they are linked to care, receive treatment, and then have follow-up after to make sure that we don't see congenital syphilis. So the goal in 2026 is to have more partnership and joint work with the correctional facility to make sure we can have that continuum of care. And then finally, our division is very big on leveraging technology. So we did implement an online salmonella case investigation form. So this is a form that we would send to residents that were interested in participating to be able to obtain information about their risk and exposure to salmonella. So individuals can choose to either do a phone interview with our DISs or disease intervention specialists, or complete this form. We rolled it out in October 2025, and as of the last 3 months of that quarter, we did see a 32% completion rate of those that actually completed the form, and we actually only saw 3% completion of interviews over the phone. So I think this is an entryway into be able to leverage technology and online tools to elicit information, both to meet people where they are and how they're able to give us information, as well as helping our workforce manage the increase of responses. And if we want to go to 2026. So Christina had mentioned this at the beginning of priorities, but specifically in communicable disease, we are looking to fill 4 vacant disease intervention specialist positions, 2 in our SC-HIV program and 2 in our infectious disease program. 2 of these positions are new to our division under the public health infrastructure funding that Christina had mentioned previously. And our goal for 2026 is to get people in, to make sure they're effectively onboarded and ensure that they're prepared to support the changes in infectious diseases, the surges, and re-emerging of diseases. Next, we want to have a focus on our rabies prevention program. So we receive over 1,000 suspected rabies exposure reports per year. So these are individuals that are bitten by domestic or wild animals. So we want to improve the efficiency of that program. So we are looking to introduce a web-based reporting system that will integrate with our current rabies prevention, surveillance, and case management system. To help increase the timeliness of report, making sure that we're gathering critical information and be able to support prompt and timely investigation and guidance for prevention. We'll also be working to update all of our communication tools. I know there's been a huge push and a lot of education around making sure that material is in plain language, incorporates health literacy principles, as well as in multiple languages and culturally competent. So our goal is to reassess all the materials that we currently have and making sure that information is accessible and available in the way people want to receive it on written and digital platforms.
So Christina, can I ask a question? What is our support around IT development and programming? Because it seems like there's potentially work that could be done that would be easier done by an internal team that had their own, I don't know what all the right titles are, but I know we have IT support, but I don't know if it comes to the level of what you're sort of mentioning here. Like, I just want, if you can remind us.
Yeah, absolutely. And Michelle can certainly speak to the work that she's done, working very closely with IT to develop these solutions. Our newly hired, almost year with us data manager has also really been integral in streamlining data collection processes and data analysis processes. So he's been working, his name is Dave Walsh. He is absolutely phenomenal and very excited to have him. But I anticipate that he is involved in some of these that you see here, and is working very closely with Michelle's team and with others to develop dashboards and other tools to help us really track the work that we're doing, but also track disease trends and monitoring. I believe Michelle's also been working very closely with Mary Craighead, our GIS analyst, around that same process.
And I will say that my staff are very engaged in figuring out how technology can be used. We do use and communicate with other state and territorial and local health departments to see best practices that they have used by leveraging, the Microsoft Office suite that we have access to and other platforms to help move forward with the utilization of technology. And that's been a great partnership, having access to that information.
Okay, very good. Thank you.
Christine or Michelle,
Yeah.
I had a question, and it's very, very down in the weeds, and my apologies for that.
Sure.
The question really has to do with the bird flu, and I'm using the analogy that Bucks County, with its really bad bird flu situation, had asked people to collect their own geese, the dead geese in their properties, etc., and had put out information initially about double bagging, but didn't talk anything about personal protective equipment, etc. I looked on our website to see if we had any recommendations. Number one, are we able to collect all the, I assume that since we have such a long border with Bucks County, that bird flu and dead geese are almost as bad here as it is in Bucks County. And B, I couldn't find the policy on the website. Did we come out with a specific policy? Do we recommend double bagging? Are we telling them to use gloves? Because I know Dr. Damsker's office initially in Bucks County had not made that recommendation, then made the recommendation, but didn't make it kind of clear about any kind of personal protective equipment if you're bagging your own geese, dead geese on your property.
I think you know, identified maybe some work that we need to do on our website. But as for collecting of animals or geese, that is done by the PA Game Commission. So there should be a phone number and link to their website. I know we do have infographics on how to handle those animals and what correct PPE to do when you're handling those animals. So we can take a review of that, but we are not currently collecting animals for testing. That's all done through the Game Commission or Department of Ag.
And we don't have as much of an issue as they have in Bucks with the Game Commission not being able to collect things, so they were being instructed to collect themselves. That's
Not at this time that we've heard of, but definitely keep that in mind. Keep a pulse on what's happening in the region. Barbara, did you have a question? So last, oh, go.
No, I'm good. Thanks.
Okay. So last is measles. You know, we are seeing a sharp increase of measles in the nation. There's been over 1,000 cases already this year across the nation. This is more than we typically see in a full year. We also are seeing the same trend statewide and countywide. So we want to take this next year to really make sure that we take time to have our policies and procedures and response plans available with this elevated risk that we're seeing across the nation, and looking at updating and improving our procedures, enhancing staff training, as well as you know, engaging our community partners to support these responses. And this is not really just for communicable. This is a collaboration that we'll see across divisions like clinical services, offering vaccine and post-exposure. It would be working with, you know, health promotion to provide education and different entities to support this. So we've seen it in the news. We know that it is coming, and we need to do both the preventative work, but also prepare for the large response and case investigation. So our goal is to continue to work through that response plan and make sure that we are keeping things updated and improving that process.
Okay, thank you, Michelle. Next, Pam Lawn from Environmental Field Services.
Good morning. So I guess I will go over our 2025 priorities first. So in 2025, we did some research to identify a new inspection system that we could use for housing all of our data for inspections and complaints. And we would like to, so what we did was we reached out to companies and different vendors and actually some of our other county health departments in the area to find out what they're using. And we were able to find like a candidate that we really like. So hopefully in 2026, that is something that we're going to be working on, is moving forward with developing that program for all of our inspection programs and complaints. So that is something that we worked on in 2025 and will continue to work on in 2026. The other priority we had is territory and staffing structure. Christina did touch on this a little bit also. We reorganized our territories and staff structure to balance the workload and support the program needs. We, again, became fully staffed in 2025. We added 2 new positions and a supervisor position, so actually 3 positions, 3 full-time positions. So this was a big help for us. And as Christina had mentioned, we were able to break up the county into 4 different regions instead of 3 different regions, which it's been. That was 2025. We can, next slide. So for 2026, one of our priorities is to develop a new inspection system to improve our efficiency and streamline our processes, as I just said, for our inspection programs and complaint programs. We want to also revise the on-call procedure to ensure fairness and consistency. We have staff that are on call 24/7. We cover, anything, any kind of emergency that might happen after hours. It happens a lot because we have, food facilities that have fires, floods, power outages, whatever it may be. That happens quite a bit. So we've always had this on-call response. So to continue that, things have evolved over the years, and we just want to ensure that we're being fair and consistent with the system across the board. And then lastly, we want to implement our plan to conduct 2 routine inspections for all medium and high-risk facilities. Now that we are fully staffed, we're able to get into all of those facilities 2 times a year. For the past 5 or 6 years, we've been going in once a year, and that's what's mandated as per Act 315. But moving forward, we'd like to start going in twice a year to those facilities. So with our, the increased amount of staff that we have, we should be able to accomplish that this year. Does anybody have any questions about any of those priorities?
Could you just define medium and high risk facilities for us?
Sure. So picture, this is the easiest way to do it. So a CVS that just has retail prepackaged food items, milk, or bread, that would be low risk. So everything else would be considered medium or high risk. They're actually prepping food and storing food, and it's just a medium and high is basically the same in a way. It's the low risk facilities that will only go into 1 time a year. The CVS's, the Rite Aids. Now, a Wawa, another convenience store, that would be considered more of a medium or high risk facility. Does that make sense? Good. Any other questions?
Great. Thank you, Pam. Next, we'll go to health equity and epidemiology. Toka Williams.
Good morning. As Christina stated, we are expecting a new director. This division is of the 7 divisions is the newest division, health equity and epidemiology, and we're still in the building phase. And we brought in a director in the fall of 2024, and she left within a year. So we have a new director possibly coming after, of course, salary board approval next week. So that new director has a lot to do because we are still in the building phase. Our priorities for 2025 included data collection and streamlining that data collection processes, as well as building out that health equity framework, and also increasing public access to health data. We're still in the process of doing these things. We completed a process and a form for internal and external data requests. It was completed, created, and implemented, as well as a data request standard operating procedure was revised. Our data manager, it has been mentioned, David Walsh, came on in May of 2025, and he's helping to streamline some of our data collection processes in-house. As for the health equity framework, we got started on that with the new director, but the new director that is coming in will pick up that. And under Chantel Mason, who was the director before, she and her team evaluated more than 20 health equity frameworks and decided that there were 2 frameworks that align with the Montgomery County objectives. So the new health equity and epidemiology director would pick up that charge. Dave Walsh was hired, like I said, in May 2025, and his role resides in the Office of Performance and Planning, and he exclusively supports OPH. We have a couple of positions, and Christina mentioned some of those positions that exclusively support OPH, but are housed in other HHS offices. Dave's position is one of those positions. Planning has begun with the OPH teams to launch data dashboards in 2026. He's working with the various divisions to determine data, the metrics that we want to highlight, and it will be an ongoing process of developing those data dashboards. Next slide, please. For 2026, we're still working on that health of the county report. And that is built on the health equity framework that was identified that I just mentioned, as well as develop health equity education series that illuminates critical drivers and strategies for addressing gaps in health outcomes. Christina mentioned briefly that we had a workforce development plan, training plan, and one of the things I identified in that plan was staff wanted more information and wanted to build their knowledge in health equity. So we're going to, when this new director comes on, we're going to develop out that series for staff. Any questions? Thank you.
Thank you, Toika. Next, David Genova from Health Promotion.
Thank you, Jay. Good morning, everybody. Our first priority was our community health assessment and community engagement work. Last year, we focused on the major health issues identified in the community health assessment and improving our outreach. We released the community health assessment report and shared it on our website through social media, and we conducted 7 community conversations. More than 90 people participated, giving us helpful feedback on community needs. We also created the core CHIP group, which included 16 dedicated members from Health and Human Services and the Office of Public Health, who helped shape our next steps. The next priority is prevention and health education. Our goal there has been to support the overall health of county residents through proactive education and prevention. We've been collaborating with the Division of Communicable team to distribute their education materials throughout the county, ensuring residents receive timely and accurate information. In addition, our staff completed HIV STD training modules and are now equipped to deliver lessons on Communicable's behalf. We continue to operate the blood pressure self-monitoring program. In 2025, we enrolled 24 participants in the program. 14 successfully completed the program during the first year, and the remaining 10 participants are on track to finish this year. We also partnered with Acclamo back in October to conduct a car seat check and distribution event. During this outreach effort, we distributed 23 car seats and provided hands-on safety instruction to 30 caregivers to ensure proper installation and use. Finally, our work with community health workers continues to grow. We aimed to increase access to support, education, and service navigation for underserved communities. To support this, we established contracts with Acclamo, Maternity Care Coalition, and the Jason Center. These partnerships, or I should say through these partnerships, community health workers are offering health education, they're doing outreach and helping residents connect to services more easily. Jay, you can progress that slide. Thank you. Looking forward into 2026, first, we are launching our community health improvement plan. This plan centers around 3 major areas, as Christina shared at the beginning. They are preventing and managing chronic diseases, strengthening mental wellness and community connectedness, and promoting safe, healthy environments. These focus areas reflect on what we learned from the community health assessment and where we believe we can make the greatest impact. So at this time, we're facilitating think tank meetings for each of those focus areas. And these meetings are on track to be wrapped up the first week of April. Next, we're working to increase our physical presence in the communities that we serve. That means being consistently out in neighborhoods, building relationships, and showing up in ways that are meaningful and dependable. Our outreach strategy will continue to be guided by data, helping ensure we are present where needs are highest and opportunities for engagement are strongest. Finally, we'll continue our community health worker partnerships with the CLAMA, the Jason Center, and Maternity Care Coalition. Through these contracts, like I had shared before, community health workers are helping residents navigate care, access health education, stay connected to community resources. These programs are essential for meeting people where they are and supporting them in more personalized and culturally responsive ways. Any questions?
Okay, thank you, David. Next, we have Megan Young from Public Health Emergency Preparedness.
Morning, everyone. So emergency preparedness was very busy in 2025, obviously getting ready for 2026. Some of our highlights in the last year, we continued to onboard and integrate our points of dispensing program. As you all may recall, our points of dispensing program is a very critical element to emergency preparedness. It's our process for how we distribute emergency antibiotics and vaccines in response to an emergency. So this year, the team worked very hard. We have 5 locations that are currently working on finalizing or have finalized their agreements. Many of these, we're proud to report, are returning sites. So sites that we had agreements with either before or during the COVID pandemic have agreed to stay on with us, which is fantastic. We love to have their continued engagement. We have 2 additional sites that are working on completing their paperwork and their agreements. And 1 location is scheduling their initial planning meeting that will be a brand new location for us. So we're very excited about that. Also, one of our previous locations has agreed to be our host site for our upcoming exercise in a few weeks. So we're very excited for that re-engagement with them. Emergency response planning was a core. It's a core to our division. It's in our name. So there was a lot of work that was done in the 2025 year around emergency response planning. We've updated our incident response plan, so the guiding document for preparedness. We've aligned that to match the Department of Public Safety's layout. This was a recommendation that came out of the initial work with Summit on our roles and responsibilities planning, was to have those 2 documents align. So we did some work to do that and ensure that we've closed a lot of our gaps between the 2 departments. We developed in 2025 our Club Cup plan. As you may recall, FIFA did a little preview to World Cup in the area in summer of 2025. So we had a Club Cup plan that is now the basis for our upcoming World Cup plan. We're also working on a mosquito response plan for this upcoming summer. We are also continuing the development of our hemorrhagic fevers response plan. Hemorrhagic fevers seem to be an emerging threat in the area. We have a lot of travel, especially with World Cup coming. It's something that we have not addressed for several years, so that is on the list of things to do. As Michelle mentioned, measles continues to be a threat, so we are working on the response to that event that's ongoing as well. Medical Reserve Corps, as many of you know, is a vital part of our division, a vital resource for Office of Public Health as a whole. We continue to grow, and we continued to grow the Medical Reserve Corps in 2025 with the recruitment of new members. Unfortunately, I could not get the exact numbers before this meeting, but we can share that out with the board members after this. We saw a uptick in volunteers after our community vaccine campaign. We gained, I would say, probably 5 to 10 volunteers just by residents that had frequented our community vaccine clinics and said, hey, this is kind of cool. We want to do that. How do we join as well? So that led to a plan of maybe having some QR codes and resource tables this coming fall, so that folks have an immediate doorway into the volunteer corps. I just would like to take a moment to highlight that 5 of our MRC volunteers are in Hershey this week attending the first state MRC conference. So they are participating in Hershey and doing a lot of work around access and functional needs and volunteer engagement. So we're excited to get them back later this week and hear all about what they learned at that event. Jay, next slide. Looking ahead to 2026, it's already been a busy year with emergency response, and it will continue to be a busy year, I think, right through the end of the calendar year. Obviously, 2026 and summer 2026 activities are a huge priority for us, at least I would say for the first 3 quarters of the calendar year. So we have FIFA World Cup coming to the Philadelphia area in July, June through July. Philadelphia will be hosting the MLB All-Star Game in July. We have America 250 events, the Welcome America concert. So various activities that we have started planning for. So preparedness is hosting planning meetings internal to the Office of Public Health every 2 weeks. We have a representative from the Department of Public Safety that sits on those meetings. We are attending many regional workshops and trainings in order to prepare for mass gatherings and looking at what our planning is going to be and what our response posture is going to be. Right now seems to be concentrated around the July 4th weekend. We suspect there will be a high increase of activity around the July 4th weekend. So actively planning for those events. As a key component of that, training and exercise is taking a huge priority this year. So as I mentioned, we have a biological 200 exercise coming up at the end of this month. That is a functional based exercise. So we will actually set up a point of dispensing and we will run simulated clients through that point of dispensing. Thank you to our clinical team. They are giving us all the nurses for a day so that we can also use this as a practice for our community vax campaign in the fall. Something we hope to get to this year, it's on a priority list for 2026, is our closed points of dispensing program development. So closed pods are points of dispensing that only serve a specific population. You see this a lot with colleges, schools, home health agencies, nursing homes, those kinds of settings. So they're not necessarily places that would be publicized in an emergency for the public to receive medications or vaccines. They would only serve their specific population. Pre-COVID, we had a fairly vast network of closed pods, primarily focused in our long-term care facilities. But since COVID, some of that planning has admittedly fallen to the wayside. So the hope is that we can find a model that works best within our community and really start bringing some of those private network locations on. It will take some time, so this might also turn into a 2027 priority, but that is the hope for this year.
Great, thank you.
Thank you, Megan. And finally, Kyle Schmidt from Water Quality Management.
Good morning, everyone. In 2025, regional LOSIS or Legionella outbreak response was that training was addressed by me to my staff. I wanted to ensure they were trained adequately in our outbreak response because it's changed over the years. It's been 25 years since we first hit our big Legionellosis outbreak, and it's changed through federal funding requires that long-term care facilities now retain water consultants. So my staff have been trained adequately in the past for facility inspections and sampling, but I wanted to make them more aware of all the recommendations and the compliance requirements that I typically had given those facilities. I want them to be able to act on my behalf and take my place when these situations arise. And as such, moving into the succession planning and staff development. As I near the end of my career, it's needed to train the staff on many of the activities and tasks that I tend to work solo for some of the smaller programs. Now, the Legionella just being one of them, giving the recommendations and compliance requirements to the long-term cares is just one of them. But I've also addressed some of these smaller programs like wastewater surveillance and Superfund site reviews and boil water advisory oversight, waterborne outbreak response like the Legionella, large-scale groundwater contamination cases, and then any environmental health issues that are not necessarily water related. These issues sometimes involve the EPA and the ATSDR and the Pennsylvania Department of Health and the DEP. I'd like to train my staff to act on my back, to act for water quality, to address those issues as well. So, and then the last one is the upgrade of software for, similar to what Pam just talked about, a software database for our water quality inspections and complaints. And we identified a new vendor, and we're working with them in the new year. So, Jay, if you don't mind going to the next slide, please. So in 2026, I'll just start with the first or the second and third. Similar to in 2025, I'm going to continue to do the succession planning, their broader program responsibilities and succession planning. There's more those topics I just mentioned. I want to elaborate on them with the staff throughout the year, give more Legionella training or refresher training, and then the third one, to implement the new software program as our new DHD system sunsets at the end of the year. We want to make sure that there's a software system in place. So going to the top one, this is a big one for me. Those that are familiar with PFAS, perfluoroalkyl substances, it's the media calls it the forever chemicals, and they're pervasive throughout the environment. The health effects are getting to be pretty well known now, and it's a little scary. And as such, the EPA reduced to extreme levels the drinking water standards for PFAS in drinking water and public water supplies. But that's public water supplies, not individual water supply sources. Jay and I have discussed considering adding PFAS to our list of required parameters for newly constructed water supplies. And we're debating whether we mandate it or at least recommend it. And that's ongoing discussions. But the reason for all of this is that public water supply sampling for PFAS for the past several years has shown a good percentage of public water supplies do have PFAS in them at low levels, but still some have exceeded these extremely low levels of 4 parts per trillion that are required by the EPA. And because of the presence of these PFAS in the public water supplies, I have to assume, or we're all assuming, that PFAS is near these supplies as well. So it's out there, and we're going to, if we find it, we're going to address it and make sure that individual water supply owners are protected as well. Any questions? Okay, thanks.
So Jay, that gets us through your entire team.
Yes, thank you.
Thank you very much. Thanks for your leadership, and thanks to the entire team. I would encourage us potentially for next year to, I think the bullet points are fine, but it could be helpful to have some actual data with like the number of sessions, the number of people we touch, the action, things that are action items, things that are sort of an update from the year prior. Just, I think that people certainly mentioned what the numbers were, but I think capturing them and having them in a document would be helpful. So, okay, Christina, I'm going to turn it back to you. Do we have time to do the pediatric immunization status?
We do. We did not receive any requests for public comment, so we do have a little bit more time this morning. Kaylin Roberts is stepping in for Dr. Lorraine. I do want to bear in mind that we are running behind on our schedule, but we do have until about 10:25, 10:30 for
Yeah,
this
that would be great.
piece. Great, thank you.
Okay, thank you. All right, Kaylin.
Excuse me. Excuse me. Good morning. I will make this quick. I knew that I was last, so I knew this would happen. I am going to talk to you today about the changing vaccine recommendations that most of you have already heard about. Dr. Lorraine, in your last meeting, did discuss that the CDC is breaking away from other organizations' immunization recommendations. This is the first time that we've seen this, as far as I know, the first time that we've seen the CDC and the other medical organizations not align with their immunization schedules. And as Dr. Lorraine mentioned last time, that the CDC late last year deviated from the recommendations of the AAP. They reduced the vaccine targets from 17 to 11. They were using Denmark's model, which he explained to you at the last meeting. But AAP does maintain the established vaccine schedule consistent with prior years. Next slide, please. So to address this misalignment, Pennsylvania has been very, very active. And on October 1st, 2025, Governor Shapiro did sign an executive order protecting Pennsylvanians' health and freedom by ensuring access to safe and effective vaccines. And I'm going to talk a little bit about that executive order. So in the executive order, he sets forth many directives. But for today's presentation, I'm only going to be talking about Directive number 1, safeguarding vaccine access for all families, and Directive number 2, updating state policies to ensure evidence-based vaccine guidance. If I went through all of them, it would take an hour. So I don't have an hour, so we're going to just focus on those 2. So next slide, please. And these are just the remaining directives. So I'm going to talk to you today about Directive 1, safeguarding vaccine access for all families. So in the directive, the Department of Health was tasked to establish a Pennsylvania-based program to provide vaccines to those who are eligible for the federally supported Vaccines for Children program in the event that the ACIP removes or alters vaccine recommendations for certain diseases for the VFC program. I did read that verbatim because I wanted to get that out very clearly. So basically, for those of you that are not familiar with the Vaccines for Children program, that program is a federally funded program. So if the ACIP removes vaccines and the CDC does not recommend vaccines, that means that Vaccines for Children providers would not be able to get those vaccines through this program. So with this, they also wanted us, Directive number 2 is they want us to follow evidence-based scientific recommendations for vaccines. So we are collaborating with the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Obstetricians and Gynecologists. Next slide, please. So what the Pennsylvania Department of Health has done is they've instituted a program called PA Cares. It stands for Pennsylvania Children's Access to Routine and Essential Shots. And this is, like I said, to address Directive number 1. So what this will do is the Pennsylvania Department of Health has established a program that VFC providers in the state can enroll in. And if the CDC or the HHS does take away recommendations for certain vaccines, we will be able to continue to provide those vaccines by ordering those vaccines through the Department of Health directly. Presently, the Office of Public Health has completed our enrollment in PA Cares. So if this does come to fruition, we will be able to provide those vaccines that might not be coming to us through the VFC program. Pennsylvania Department of Health is encouraging all VFC providers to enroll. And to date, 500 VFC providers have enrolled in Pennsylvania and 100 are pending. So very good uptake. So our fear did come true. So on January 5th, the Health and Human Services did make recommendations and it did have schedule changes. So what they did is they removed routine vaccinations for recommendations for hepatitis A and B, COVID-19, rotavirus, flu, and meningococcal disease. They took away recommendations for all folks and just made certain vaccines for high-risk groups and made some with shared clinical decision-making. They changed the RSV immunization recommendation. They recommended that the HPV vaccine, which was a 2-dose series, to be only 1 dose. They did say, though, that they will continue, that these vaccines, regardless, will be covered by the Affordable Care Act, at least through this year. So next slide, please. So also, in addition to that HHS recommendations coming out, the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Obstetricians and Gynecology also put out their 2026 immunization schedules. And again, as I mentioned, all of these schedules are not in alignment with what the HHS is putting out. And this aligns with directive number 2. And we are, per the directive, we are to follow evidence-based vaccine recommendations by our colleagues at these organizations. And so AAP continues to recommend 18 vaccines, unlike the HHS and CDC schedule. And therefore, in Pennsylvania, including Montgomery County, we are following the AAP, the AAFP, and the ACOG immunization schedules. Next slide, please. So this just came through last week. This is brand new. Something else that Pennsylvania is doing is that they have joined a multi-state lawsuit to defend vaccine policy. So our governor signed on to a lawsuit that I believe it's about 15 other states. I think Arizona started it. And basically what they are doing is they are saying that what is happening at the HHS by removing longstanding universal recommendations and ignoring scientific evidence could undermine public health. Our governor would like to restore our evidence-based guidance to protect our families and our ability to make informed healthcare decisions. Next slide. And in the Office of Public Health and our Montgomery County Immunization Coalition, we're doing our darndest to try to ensure that our residents know what is going on, because it's got to be very confusing for everyone out there. What do we follow? We've got these different recommendations. Who are we supposed to listen to? So Dr. Lorraine spearheaded something that what we call Ask the Experts webinars. And in these Ask the Experts webinars, we bring in experts to talk about the emerging issues and help to clarify these ongoing issues with our public. Next slide, please. So our Ask the Expert webinars are planned for next month, April 8th at 7 p.m. We'll be doing an English version. And on April 15th, actually, I think it's at 6 p.m. we'll be doing a Spanish version. We're working with our partner Aclamo to provide a Spanish version. Our registration will be coming soon. We'll be getting flyers out and promoting those Ask the Expert webinars. In addition to that, the Pennsylvania Department of Health is doing a video series to help get the message out about vaccinations and the importance, and that we have in Pennsylvania, there's been no changes in vaccine availability and recommendations in PA. And I believe we're going to show the videos. And then I think I'm done.
I'm a pediatrician with decades of experience treating children and their families. I want to assure you that vaccines to prevent childhood diseases remain available and covered by insurance here in Pennsylvania. There are no changes in vaccine availability and recommendations in Pennsylvania. For school-age children, Pennsylvania regulations for vaccines remain exactly the same. I want you to know that pediatricians have always used shared decision-making and consent for vaccines. You can find more information on vaccine recommendations from trusted medical professionals online at pa.gov/vaccines. If you have vaccine questions, please talk to your child's pediatrician so you can decide which vaccines might be right for you and your family. Over the next few weeks, the Pennsylvania Department of Health will be providing more information about vaccines and how they protect children from vaccine-preventable diseases. So stay tuned.
Okay, Kaylin, thank you very much. Thank you for being last and also for being very efficient with all the things you had to share. I have two things. One, are we going to show another video?
We can send this one out.
Yeah. I want to make sure we end on time. Sorry. Yep. So first, I want to say thank you to the entire team. I think that this has been a really comprehensive overview of the work from 2025, which is to be applauded. And I thank you, and please extend on behalf of the board our appreciation for the hard work of each of your teams. I am excited about the new positions that you have and that you filled. And so again, thank you very much. We appreciate that. And if we can build in metrics for next time, that would be terrific. But before we end the meeting, and Christina, I'll let you have the last word here. But I just wanted to ask if our next board meeting is June 3rd, it is in person. I want to ask Christina to say, like, if there are changes that are happening in Washington that the board should be made aware of. I don't think we should wait till June. And I'm not saying that we have in the past, but I would just encourage you to send us emails and give us updates if there's things that you want us to be aware of that you don't want to assume that we're aware of ourselves. And then if there are things that impact our ability to deliver care to the Montgomery County residents, then our board wants to know, and our board wants to be part of that conversation. So if you need all that to say, if you need us, we are here to support you and to listen and to advocate on behalf of all the residents of Montgomery County. So again, thank you so much for this great amount of work, and we really appreciate it. And I will stop there if anybody else has any other questions, and I'll let Christina close us out before I call for adjournment.
Anything from any of the
Christina,
other board members? I think we are clear. Thanks to all of you for making time, and I appreciate the commitment that you all share for health and wellness in our county. The landscape at the federal level, of course, is evolving, as you all know, day to day, week to week. We can certainly come up with a cadence to share out updates as we're receiving them, so that you all have a clearer picture of how that is affecting our work here in Montgomery County. We, again, appreciate your time. We appreciate your commitment and your support. Thank you.
Thank you, Christina. And I will call for motion to adjourn.
So moved.
Second.
Thank you. Second.
Second.
Thank you. All right, we are adjourned. Thank you, everyone.
Thank you.
Have a great day.
Thanks.